Hi, my name is Clevetta Drew, and I'm a gene therapy recipient based out of National Institutes of Health in Bethesda, Maryland. I decided to do the trial after being diagnosed with sickle cell at the age of 18 months. I had no issues, generally speaking, as a child, but around the age of 19, the crisis began to rear its ugly face, and I had many painful pain crises. Over the years, they increased, and I was introduced to another clinical trial that did give me some relief and allowed the crisis to subside for quite a few years, but then they began to return again, and I looked for other options and into other trials like the bone marrow transplant. Ultimately, I decided to do gene therapy because I didn't need a donor. It was very scary because it uses a viral vector, including HIV, which no one wants to worry about whether or not they will be having to deal with another disease when you're already dealing with one. But it was explained very well to me how that is a dormant virus that they use to allow the body to produce the cells without the sickling. So I also had trusted and supported family members, and my boyfriend was also a registered nurse as well as my mom. So, with the knowledge of those two, as well as the team and prayer, I decided to do the gene therapy transplant. I think one of the greatest things that happened is like a new birth happened to me. I felt like a new person before I even left the hospital. It was a very long, intensive screening process from the time, I would say maybe from September of 2018 until about October of 2019 was the screening process and the procedure. Once I received the cells in October, I was inpatient for about 3 weeks. And when I went home, before I went home, even I felt like a new woman. But it did include busulfan, which is a chemotherapy agent, and it was very strong. So I had a lot of adverse events and side effects that occurred due to that. I had to deal with that for about a year before I completely recovered from the chemo. But overall, my health has changed. I like to tell people I'm not at 100%, but I'm not at 40. So I would like to believe I operate around 75, 80% of good health. There are still some things that I have to deal with because any pre-existing conditions do not go away. So I still have a lower blood count, um, but better than before. My iron is very high, so I do phlebotomy treatments monthly to get my iron down. And I've had to have 3 hip surgeries, including 2 hip replacements, because I'd already had a condition called avascular necrosis due to the deterioration in the bones, in the hip bones from the sickling. Overall, I can say I live a pretty normal life. I don't have any need for pain medication anymore. I can be seen for a doctor for something like a cold and not a pain crisis. And generally speaking, I'm able to function as a regular adult working. I was able to get back to work full time after being on disability for quite some time. Um, I think some of the challenges come into plays is that gray area when you are quote unquote recovered, but you may still be dealing with some issues, like I mentioned, that I'm still facing every day. There are changes with your insurance, and then also you may feel a little misplaced from the community because you're in this new category of your health status. And being born with the disease, you do develop relationships with people who have gone through the same thing. So it's a bit difficult finding a new tribe. And one of the things that I have come to enjoy is exercising and step aerobics. So I found, friendships there within the gym, within work, and just drawn closer to my family when I wasn't always able to be available and be with them for important events and just everyday life. I can now show up for those things and show up for myself. So I would recommend the transplant for anyone. I talked to anyone about it who asked, and I was very excited about this project. Thank you so much for including me, and I wish you all the best.